What are allergies exactly? Why do some people have them and others don't? How can you prevent or treat allergies? Hello and welcome to Curiosity, where we explore fascinating topics from history, science, culture and more. Today we're going to talk about allergies, those annoying and sometimes life-threatening reactions that affect millions of people around the world. What are allergies? Allergies are abnormal immune responses to harmless substances called allergens, such as pollen, dust, food or animal dander. When you encounter an allergen, your immune system produces antibodies called immunoglobulin E, IgE, which bind to cells called mast cells. These cells then release chemicals like histamine, which cause inflammation and symptoms like sneezing, itching, swelling or rashes. In some cases, allergies can trigger a severe reaction called anaphylaxis, which can cause difficulty breathing, low blood pressure and even death. Why do some people have allergies and others don't? The exact causes of allergies are not fully understood, but there are several factors that may influence your risk of developing them. One factor is genetics. According to a study published in the Journal of Allergy and Clinical Immunology in 2020, certain genetic variants associated with asthma and allergic sensitization may also increase the susceptibility to severe COVID-19. Another factor is environmental exposure. Some studies suggest that early exposure to allergens or infections may protect against allergies by stimulating the immune system and promoting tolerance. However, other studies suggest that too much exposure to allergens or pollutants may trigger or worsen allergies by damaging the mucosal barrier and causing inflammation. How common are allergies? Allergies are very common and affect people of all ages, races and genders. According to a study published in the Journal of Allergy and Clinical Immunology in 2017, the prevalence of food allergies and intolerances in the U.S. was 10.8% for adults and 7.6% for children. The most common food allergens were shellfish, milk, peanut, tree nut and egg. The study also found that women were more likely than men to have food allergies or intolerances, and that Asian Americans were more likely than other racial, ethnic groups to have them. How can you prevent or treat allergies? There is no cure for allergies, but there are ways to prevent or treat them. One way is to avoid or reduce exposure to allergens by using air filters, cleaning regularly, wearing masks or gloves or taking medication. Another way is to undergo allergy immunotherapy, AIT, which involves injecting or ingesting small doses of allergens over time to desensitize the immune system and reduce symptoms. According to a study published in The Lancet in 2021, AIT was effective in reducing symptoms and medication use for allergic rhinitis, hay fever, and allergic asthma for up to 10 years after treatment. What are some new discoveries about allergies? Researchers are constantly looking for new ways to understand and combat allergies. Here are some examples of recent discoveries. In a study published in Nature in 2022, researchers found that multiple nutritional and gut microbial factors were associated with allergic diseases in Japanese children. They identified several dietary components, such as vitamin D, omega-3 fatty acids and fiber, and gut bacteria, such as bifidobacterium, that were protective against allergies. In a study published in Nature in 2020, researchers found that infants who consumed egg allergen in their mother's milk had a lower risk of developing egg allergy than those who did not. They suggested that maternal milk may be a natural way of inducing oral tolerance in infants. In a study published in Allergy, Asthma and Respiratory Disease in 2020, researchers found that the causes of food allergy varied according to age and severity in Korean patients. They reported that cow's milk was the most common cause of food allergy in infants, while shellfish was the most common cause in adults. They also found that anaphylaxis was more frequent in peanut allergy than in other food allergies. That's all for today's episode. Thank you for watching Curiosity. If you enjoyed this video, please like and subscribe for more content like this. And don't forget to share your thoughts and questions in the comments below. Until next time, stay curious,